2-stage resection, and now we have a patient with no evidence of disease, and we continue to follow her, continue to do surveillance, and that's probably the most difficult part, because you can't go to a book and really look up what you need to do, because there's not a lot of these patients out there. But we keep a close eye on all of them that are going through this, and again, something comes up, we talk and share information.
And from what you said, I think there are two important points. First, what made you decide to look at Ruth's CT scan again for the second time? Was it her CT scan or her MRI?
Her CT scan.
That you looked at for the second time?
Well, you have a way you work things up, and I had done just about every test I knew to do on Ruth, and at the end of the workup, it just wasn't making sense.
What wasn't making sense?
Well, initially what was proposed by the radiologist is that she had hemangiomas, which are benign tumors of the liver and require absolutely no intervention. But nobody could ever, solidify that. Well, it looks like a hemangioma, but it's got findings that aren't quite consistent with that. And there's multiple ones, and it wasn't adding up with what I know, I need to have for me to go to the patient and say, we're not going to worry about this, or we're just going to watch it, or it just didn't add up. And I don't know if I can really put that in words, but from training and from what I'd seen experiences-wise, it just didn't make sense to me. And so basically I went back to the radiologist and I said, I think this is something more than a hemangioma. I think we're missing something, and I said, I just want you to look at the scan again. I said, you might tell me there's nothing more there, and it's that sickening phone call and that, devastating phone call, and he goes, Mike, we missed something. She has a huge mass in her small bowel. Well, then it started making sense, and I think as a physician, if it doesn't completely add up, you gotta ask yourself, are you really making the right diagnosis? And it didn't add up. 2 + 2 didn't equal 4. It wasn't coming up something short of that. And so I went back, and fortunately the radiologists are good people to work with, and they listened to me. Again, there's a collaborative example. They listened to what I was saying. I'm a primary care physician calling up and saying, I think we're missing something, and I'm trying to tell the expert, that they're missing something. That doesn't always go over real well, but we had a good relationship, and we found it, and and that's fortunate for Ruth and fortunate for all of us, and we need to, as physicians, have open minds and always listen. So.
And Dr. Zaruba, have you spent a lot of time since Ruth reading about carcinoid cancer and doing a lot of research? I hear laughs from everyone.
Yeah, more than I ever thought. I've learned more about carcinoid than I ever thought I'd ever learn about carcinoid, and it's fascinating to me. I think it's it's kind of neat. We can take the thing that makes carcinoid the hardest to treat, and that's its slow growth, and exploit it by doing something like what Dr. Botha does. We're taking the weakness and we're turning it into a strength. We're exploiting what makes carcinoid so hard to treat. And I think what's so neat for me is that we are bringing new options to carcinoid patients that I haven't seen out there. There's certainly other facilities doing surgery, but in Ruth's case, I can tell you I've talked to numerous experts, none of which would even consider a surgical procedure on her. So we're bringing new stuff to the table, and I think we're going to give options to patients who in the past haven't had options, and that's important.
Oh, I think that's incredibly important, and that's so exciting. It's very exciting to be here with the three of you today. And it sounds like what we can take from this example today is first that patients should always push their doctor, it sounds like, or work closely with their doctor, and that communication is very important and collaboration among doctors. What other things would you three recommend that neuroendocrine tumor patients ask their doctors, or what should they look for? I think another thing that's so important here is that it's a multidisciplinary center at the Nebraska Medical Center. So you have terrific experts that can interface with primary care physicians. What else would the three of you recommend that a carcinoid-related neuroendocrine tumor patient should look for? Anything, or have we?
Yeah, you've pretty much covered it all from our point of view.
Yeah.
I mean, it is important that you do push your doctor. Information is available to patients. through the internet, through websites such as your own, and armed with that information, you are able to push your primary care physician and to be able to get to a place that can offer a multidisciplinary tertiary approach to this and incorporate the basic level of care that's needed for every patient. And it's patients have the power to do that, and they need to. They cannot accept an answer that doesn't feel right to them, and they need to seek out places that they have confidence in and doctors that they have confidence in, because, and this is something I've said before to our patients, is this. I understand that this is, when I see these patients for the first time, this is the single most important point in their lives. And I must recognize that, and us as physicians need to recognize that this is probably a big turning point in this patient's life, and this day is the single most important day in their life, is this meeting with you, with their physician. And you need to make it that you feel that as well as the physician, that this is a big day for them, and take the care that they expect from you. And that's a lesson we all, I think, have learnt and will continue to use in our practices, is that this is what patients expect from us, and we need to live up to it.
Terrific. I think that's a wonderful point on which to close. Thank you so much to each of you for your time today, and thank you to Nebraska Medical Center. It's a cutting-edge facility where each of these doctors are practicing and working together. I think it's very important that all of us patients listen to what they said and apply that to our own cases. So Dr. Botha, Dr. Fitzke, and Dr. Zaruba, thank you so much. Again, we're here at the Nebraska Medical Center. Thank you very much to the Nebraska Medical Center for allowing us to be here today. My name is Nancy O'Hagan, and I'm with the Caring for Carcinoid Foundation. You can find this interview at the Caring for Carcinoid Foundation website or on the Nebraska Medical Center website. Thank you very much.